All right, so now we're going to talk about prenatal education. What do we need to be teaching our patients about pregnancy and labor and birth and childcare? So first of all, when do we do this? We need to be doing some teaching with every prenatal visit. Sometimes we might be in the position of providing a formal prenatal class, which is awesome, but we often don't get that kind of opportunity to educate our patients. So with every prenatal visit, that patient needs to be educated. We need to teach them about what changes to expect, maternal changes, what changes to expect in the pregnant body, and also a little bit about fetal development. We need to teach about nutrition, how to maintain adequate nutrition to support a pregnancy. We need to teach about hygiene. Remember, UTIs are a risk in pregnancy. We're more likely to get a UTI in pregnancy. It's more likely to go longer without diagnosis because the symptoms can kind of be confused with early pregnancy. And also, if we develop a kidney infection from that, pyelonephritis can actually contribute to preterm labor. So we want to teach about hygiene and UTI prevention. Kegel exercises can help strengthen the pelvic floor, which may make birth easier, but does actually usually help maintain urinary continence and prevent uterine prolapse. If the patient is planning to breastfeed, we want to encourage them to breastfeed. There are some contraindications for breastfeeding, and we need to make sure that we're teaching patients who should not breastfeed about that. If the mother doesn't desire breastfeeding, that is the number one contraindication. If they don't want to breastfeed, rather than trying to push them to do that, we need to be supporting the choice they made and support them in safely feeding their child without breastfeeding. If they want to breastfeed, then we need to focus our support on helping them to be successful with that. Women who are HIV positive should not breastfeed. There are some circumstances in which that's encouraged, but that's generally going to be encouraged in a place where clean water is not available. And the way that determination is made based on the World Health Organization is if the risk of that infant dying of diarrheal illness in the first year of life is higher in that location than the risk of getting HIV from breastfeeding, then breastfeeding would be encouraged. So in developed nations, HIV positive is considered a contraindication for breastfeeding. Untreated active tuberculosis is considered a contraindication. Active herpes simplex lesions on the breast. So if they have cold sores on the breast, and yes, you can get cold sores, or it can spread from genital herpes, either way. It's the same virus, just usually two different, it used to be two different strains, but they've kind of mixed. So still herpes simplex virus. You can get those lesions on any skin that may be a little bit broken. So if they have active herpes lesions on the breast, they should not be breastfeeding, especially from that breast, because that can spread to the infant. Human T-cell lymphotropic virus, untreated brucellosis, and chemotherapy, radiation, and a very few medications. It's actually really common for people to be told not to breastfeed with a medication when it's safe. So there are some experts that can be consulted with that, but there are very few medications that really aren't safe for breastfeeding. Some breastfeeding challenges. If they have inverted nipples, there are some things that we can teach to begin working on decreasing that, the degree of inversion. If they plan to breastfeed, we can teach them about choosing a supportive nursing bra and about where to obtain a pump if they plan to pump. Okay, so we also need to be teaching pregnant patients about dental health. Periodontal disease, gum disease, is actually associated with preterm labor. So we want to teach about dental health. Physical activity, we want to encourage people in pregnancy to be active, but we don't want them to make just a drastic change in activity level. So we don't want to go from being a couch potato to running a 5K during pregnancy, but we want to encourage activity generally. We want to teach good body mechanics. Back injuries are common in pregnancy because of that sway back, that lordosis of pregnancy, and also all of the joints and all the become a little bit looser. So we want to teach good body mechanics. Rest. Pregnancy is tiring. It requires a lot of energy to build a person from scratch. And so rest is important. We want to teach about employment, about job safety and maintaining health while on the job. I can tell you that one thing we see a lot of in McCurtain County is in the summer, a lot of people who work at Tyson come in with preterm contractions because they get dehydrated and get a UTI because they can't leave the line very often to get drinks or go to the bathroom. So we want to talk about job safety and maybe adjustments to make for that. We want to talk about clothing. We don't want people wearing tight, restrictive clothing, like the old pregnancy girdles that used to push everything in and hide it. That can cause a lot of discomfort for one. Travel, as long as the pregnancy is healthy, travel is usually safe up until the last month. After 36 weeks, it's usually discouraged because you don't want an unexpected delivery in a different location. Medications and herbs, we want to make sure that our patients understand what medications and herbal remedies might be unsafe in pregnancy or might have limited safety. Immunizations in pregnancy are safe if they are if they're not a live virus. Any live virus vaccine should not be given in pregnancy. So vaccines that are not live virus can be given in pregnancy. Now, a lot of people have been concerned about getting COVID vaccines in pregnancy. There has not been shown to be increased risk to COVID vaccine in pregnancy. COVID itself has been massively dangerous for pregnant women. So I know that a lot of people are very hesitant to get a new vaccine in pregnancy. And it is still a rather new vaccine, but the risk of getting COVID in pregnancy is pretty serious. Alcohol, tobacco, caffeine, street drugs, and marijuana. Alcohol should be avoided during pregnancy. We want to teach that because we don't know what the safe dose is. Fetal alcohol effects and fetal alcohol syndrome can occur with excessive alcohol intake in pregnancy, and we don't know where the safe level is. Okay, tobacco should be avoided in pregnancy. It's a vasoconstrictor, and it's going to cause decreased placental perfusion. Smoking in pregnancy is a common cause of decreased size of the placenta, a smaller placenta, and a baby that doesn't grow as well, intrauterine growth restriction. Caffeine is safe in pregnancy in moderate amounts, but excessive caffeine intake has been associated with miscarriage. Street drugs. Number one problem with street drugs is you don't really know what's in them. So we want to really discourage people from taking any substances they purchase illegally in pregnancy because they really don't know what they're getting. Some different drugs have different effects. Opiates can lead to opioid dependency. Benzos, if someone takes a lot of benzos during pregnancy, the baby at birth can have some withdrawal issues as well. Meth and cocaine, things that are uppers, they actually can cause restricted growth, restricted placental size. That can lead to placental abruption. They can have some pretty significant effects. And also, you also have the other effect of whatever substance that you don't know is present in that drug. So we want to really discourage. A punitive approach is usually not helpful. It tends to cause people to hide their drug use rather than get better. So we want to promote drug treatment to promote abstinence. Marijuana has some known risk in pregnancy. We strongly discourage that use in pregnancy. There are women who use marijuana for morning sickness, but there's a risk that it can affect fetal growth. It can affect growth of the placenta. So there are actually some negative effects of marijuana as well. We want to teach about the normal discomforts of pregnancy and some things to help manage them. We want to definitely make sure they know those red flags or danger signs. We want to teach people how to recognize preterm labor. We want to teach about safe sexual activity during pregnancy. Sex is safe in pregnancy most of the time. If their water's broken, nothing should go in the vagina. And if they're in preterm labor, any kind of sexual stimulation or intercourse can actually trigger more contractions. Generally, other than that, sex is safe during pregnancy. Psychosocial support, we want to teach them about the importance of having a good support system. Okay, in the next section, we're going to talk about some different choices that people have for giving birth.